Hey everyone, I'm Simon Robertson. I'm the founder of KindVr, and today I'm going to be talking about the medical procedures that we support using custom VR applications, some of our clinical trials and some of that research, and then I'll be sharing our design philosophy and lessons learned when it comes to creating custom applications for difficult medical procedures for patients. So I started KindVr over 7 years ago at UCSF Benioff Oakland Children's Hospital, working alongside child life specialists and working with sickle cell patients. And that's where we created our first clinical trial. And since then, I'm proud to say that we're now being used actively in over 65 hospitals in the US and Canada. We have 15 clinical trials partnered with a variety of pediatric hospitals. And I want to mention that we're really customized and focused on procedures. So we've always been targeting and trying to understand what are the most difficult procedures that patients have to go through, and how can we create safe, effective applications that can help patients mitigate pain and stress. So we provide a clinically validated tool for child life specialists, nursing teams, and emergency room technologists to use. And we have a real focus on safety first when it comes to analyzing the procedure. And we also have an emphasis on ease of integration. We want to make sure that what we're providing is a simple tool that can be kind of added to the workflow and can benefit patients and be useful for providers. So that's what we do. We make custom VR therapies to help patients lower their pain and stress during procedures. And we do that by trying to understand the patient or the procedure. And then we develop a custom VR solution with our team of developers. And then we partner to run clinical trials for specific outcomes. And then we refine our applications during that study or during those trials. And then finally, once the studies are complete, we expand our VR therapy offering and provide it to all of our hospitals and centers for routine use. So let's dive into our procedures and our common use cases for VR interventions. So port access is one of our most common use cases. And so that's a Metaport access procedure primarily for oncology patients who are undergoing chemotherapy and that sort of treatment. So our first study was at Sick Kids in Toronto, and then we have studies at Comer Children's in Children's Wisconsin. For sickle cell, we have a real focus on pain management while sickle cell patients are undergoing a vaso-occlusive pain crises. So we've completed studies at Oakland Children's, and then we have active trials at St. Jude Children's and more recently, Children's Michigan. In the emergency room at Sick Kids in Toronto as well, we've completed a study looking at IV insertion procedures. And similarly, in the Bronx at Children's Hospital Montefiore, we've completed a study looking at laceration repair, also known as stitches. And then at that same hospital, we have another study looking at venipuncture, so blood draws for patients. And then at Cook Children's in Texas, we have a study starting up pretty soon looking at VCUG procedures, which is a diagnostic imaging procedure for catheter placements. And for that one, we've designed a custom application for the supine body position where you're laying perfectly flat. And we're really hoping to learn quite a lot through that trial. At Dell Children's, we have a study looking at dermatology procedures, so that's skin biopsies and other painful procedures, unfortunately. At Nationwide Children's, we have a study looking at orthopedics, so that's leg brace adjustments. And then Phoenix Children's, we have a pre-op anxiety study that's been completed where patients actually wear the headset as they go through from the pre-op waiting room into the operating room for tonsillectomy procedures. And then at Oakland Children's, we've completed a trial, and we have another one ongoing at Children's Colorado looking at MRI practice. So that VR application is a tool to help educate and desensitize patients before they do their MRI scan. So now on to some of our research. One of our first studies was done at UCSF Benioff Children's Hospital, Oakland, and that looked at sickle cell patients on the second day of their vaso-occlusive pain crises. So they're coming to the hospital with 10 out of 10 pain usually, and staying at the hospital for about 5 days. So on the second day, we had patients fill out the adolescent pediatric pain tool. So they colored in their body areas affected by pain. They rated their pain score on a scale of 0 to 10. And then they completed these descriptor words that correlate to different elements of pain. Some are emotional, some are temporal. It's kind of another insight into pain. So for body areas affected, pre our VR intervention, on average, patients gave us 3 out of 10, or sorry, just 3 body areas affected by pain. And then afterwards, that number dropped to 2. And then for those descriptor words, patients filled out on average about 20% available, and that number dropped to 12 after virtual reality. And then most importantly, for that pain intensity, on average, patients gave us 7.3 out of 10 on that pain score. And asking their pain score immediately after VR, that number dropped to 5.8. So we saw a 21% reduction in pain. And working with our team there, we asked them what they thought of this, and they reminded us that these are patients who are already on some of the world's strongest pain medications, fentanyl and what have you. And they were really encouraged to see that VR was able to cause this reduction, because they were suggesting that, hey, when we increase the dosage, we don't really see this 7.3 number move. So we're really encouraged that virtual reality can help patients in the inpatient setting, and hoping to learn more with our follow-on study at St. Jude. And then we have another study looking at port access procedures at sick kids in Toronto. And this study is especially important to me because of our collaboration. So for this one, and just to let you know, for those who don't know, port access is a needle procedure usually located on the chest. It's used for chemotherapy. And what we were able to do is have oncology patients wear the headset and give us feedback on our application. At that time, it was KindVr Aqua, our underwater experience. And we collected feedback from them before even doing the procedure. So, do you want to wear the headset during it? Do you think you'll feel comfortable? And trying to get a sense of patient body position. And then we refined the application and had patients then start to wear the headset during the actual procedure, and collected feedback, and then made some modifications, and then did another cycle of the trial with patients during the actual procedure. So this is a great way to kind of start with an idea, collect feedback from patients, refine it, and then refine it again before releasing it. And what we're delighted to say is we made a variety of changes to the application and created what we now call KindVr Lookup, which is a version of Aqua that's really designed for patients in their hospital bed at about 45 degrees. And what's great about that is everything that they interact with is above eye level. So in terms of patient body position, patients are leaning back and keeping their head up. They're focused at interacting with fish and dolphins at the surface of the ocean. There's no coral or anything below them. And that way they're keeping their head up. They're not breathing on the sterile field. They don't feel like they need to lean forward to look down. And that is sort of the core example of what we do. And then during that study, we were able to emphasize patient and staff communication. We found that the communication plan that a patient and a provider has, or a child life specialist and a patient has, as much as VR can help pull you out of that hospital room and drive your attention into that virtual world, it's still important to maintain that communication and allow patients to dictate if they want to take a moment to take off the headset or take a look around or want updates on how the procedure is going. We learned it's really worth maintaining that. The power of VR is great, but the power of patient choice is just as important. And as I mentioned before, it's really where we figured out the patient body position, their sense of security, allowed us to double down on our emphasis on infection control, especially on a procedure of that kind. So now let's talk a little bit about designing for medical procedures. And I'm going to share some of our thinking as we approach each of our applications. So first is designing for safety. Is motivating it is to make a highly interactive, immersive game using all the tips and tricks and tools that VR provides to us. It's really important to emphasize safety first and prioritize the procedure. So let every design decision that you're making come from what is the procedure, what direction is the patient facing, how long is it, what kind of interaction do you want them to have, and let that kind of set the stage first. And so, of course, we're trying to minimize patient body movement, which is a little bit antithetical to VR. In VR, you want to be moving your hands or spinning around. And for us, we're designing for a hospital bed or a chair or a supine body position or a reclined body position. So it's really important to provide easy interaction and interactions that allow a lot of customization depending on what hand is free, where the needle or the procedure might be happening. So it's important to focus patients' attention forward. So for example, in all of our applications, you're allowed to look around. So in Aqua, it's fine if patients do want to, especially at the start, look behind them. And in that one, they're actually in a little submersible, little undersea submarine. And so they can look behind them, but patients quickly learn what I see behind me is just bright white, and they have kind of a window to the world. And so they quickly know, oh, if something goes overhead and passes by me, I can follow it with my eyes, but pretty soon it's going to be out of bounds, and there's no reason to try and turn around and track it. So it's important to occlude patients' vision so that their center of attention is in front of them. And in terms of the experience and kind of some of the interaction, we really recommend that you start slow. So don't dial up music or anything like that. Let the experience ramp up over time. So introduce things slowly. Let patients get familiar with the environment, the game actions, make sure that they can hear the patient or the provider so that a child life specialist or a nurse can communicate with the patient. And let that moment sort of sink in before you kind of go from 0 to 60. And then one thing to consider is not just the procedure, but also the patient's condition, what medication they're on, how much stimulus really do they want to accept at the start, and make sure that you're emphasizing something simple and digestible to set the stage. And as I mentioned before, the communication plan between child life specialists or nursing teams and patients, make sure that that's still there. So you don't want to kind of take over. Again, this is really a tool for child life specialists to use and not something that is going to replace them. So it's up to child life specialists to decide when to interact and bring this into the patient's room, and to make sure that they're sort of leading the moment and communicating with the patient. And then finally, it's really important to iterate based on research. So leading a design team, we have a sense of what the procedure is and what a patient's going through, and try and bring as much empathy and understanding as we can to this difficult moment. But it's really important to make sure that you're doing clinical trials so that what you've created is clinically validated, and both for outcomes around pain scores and comfort, but also around just safety and usability. And we think that's a very important step to what we've been able to provide. So then in terms of accessibility, it's really important to think about your patients in terms of the widest range that you can have an impact on. So often you're working with restricted mobility patients, patients who may not have use of their hands, may not have use of even moving their head, and you want to make sure that they have some connection to the experience and can benefit from that. So it's important to think about having simple interactions that are easy for them to do. So not reaching out and moving levers or pressing a series of buttons, but hopefully, say in this example with the elephant I just showed you, being able to just move your head gently and still be able to do the main action, which is giving these creatures a drink of water and washing them off. So you want that first interaction to feel like a success for them, so they're not fighting uphill to participate and interact with the application that you've created. And then in terms of controllers, it's really important to use one button or sometimes even no button interaction. And so by one button, I mean one button to start the application, one button to pick their application if they're doing that, and one button to do the main game action, and one button to resume. So creating complicated menus where you're picking left and right, or entering certain codes or creating a character, that's a little bit too much. And we want to make sure that the widest range of patients can participate. And to that end, it's important to have multiple inputs. So a controller that can be held in either hand, doesn't really need to be moved, hopefully can be used by just moving your wrist very gently, or even better, gaze control as an option for patients. So having multiple options available within the same application is really worth including. And similar to starting slow and ramping up, getting into the application and getting it started should be really simple. So patients hopefully should have a simple menu or start screen to acclimate themselves, but nothing too complicated, no character creation. And you want them to kind of be able to dive in. And this is really important when it comes to emergency room use cases, where time is, of course, of the essence. And then in terms of patient comfort, we really think it's worth having nature-based environments with a very clear horizon. So, and you want to maintain that. It is possible in VR to kind of rotate environments, but we found that that mismatch of where your gravity should be pushing you in VR and where it is against your hospital bed is an important one to not break. So it's more important to design an application that accommodates how a patient's laying in the real world and matching that so that there's no mismatch. So it's really worth designing for the patient body position. And then in terms of motion, constant velocity, no acceleration, that's important as well. And then in terms of environments, we think creating surreal environments can be very engaging and interesting in VR, but for easy understanding, we think nature-based environments and nature-based experiences are really important. And then we also recommend having zero text and zero reading, so patients aren't having to decipher complicated menus, and that we can work with a wide range of patients no matter their verbal ability. And then in terms of game actions, it's really important to have simple interactions for patients that they understand. So you want to make sure that you're not having them do something that's really complicated or bizarre. So collecting fruit is a great one. Giving animals a drink of water, coloring fish or objects, simple interactions that make sense to patients is really where you want to start. And then in terms of gameplay and what patients are doing, no failure is really an important motto. So you want to make sure that patients aren't dying, they can't fail. All these traditional game mechanics that use adrenaline and fear of failure, number of lives, those really don't have a place in what we're designing. You're not trying to compete with the likes of Fortnite and Call of Duty. You're creating a simple, easily digestible escape. And then in terms of allowing patients to engage or disengage with the environment, you want to make sure that we're providing active or passive distraction. So patients who are leaning into the environment as much as they want and finding all the fish or collecting all the fruit, that seems great. But also if patients want to disengage and just look around during the procedure, I think both of those should be available to patients. So that's my presentation. Thanks for your time and attention. If anyone out there is interested in seeing our completed trials or has any questions, please reach out to me. I'm always happy to send over some of our published studies and posters, and hope to hear from you soon and looking forward to your questions. Thanks.
That's some amazing work being done by KindVr. We've got Jack Robertson here with KindVr as well. Hello, Jack. How are you doing today?
Doing great, thanks.
Excellent. Love the sort of mural of photos I see behind you on your office wall there. That's so cool.
Yeah, we love that. We love those kids.
Excellent. Well, hey, we've got a few minutes before our break, so friends in the chat, go ahead and pop your questions in for Jack and KindVr, and I'll pop back on in just a second. While we're waiting for some questions to come in, Jack, how long has KindVr been doing this work?
A little over 7 years now. So Simon started it at Children's Hospital Oakland, as he mentioned, and then we've just steadily added more procedures, and added more hospitals as we've grown.
Yeah, that's awesome. And we were getting asked about slideshows afterwards. So the whole symposium is being recorded, which will of course include all of the information in the slideshow. So anybody who registered for it will have access to those recordings pretty quickly. And then Abe is also reminding us that yes, presentation materials will be available for all attendees. Jack, is there anything you want to add to what Simon said
Scott asked about what engine Simon's building in. I don't do that. I do just the hospital relationships, obviously. But Simon uses Unity and builds it, all the experiences in there. Yep. Had any success with patient position laterally on their side? Yeah, we do not have that. Simon just created the supine experience for the VCUG that we have, and that's laying completely flat. So there is demand for the sideways one, lumbar punctures, that kind of thing. And you can use Animal Valley, which is another experience. But I know that Simon is looking at doing something specific for the side and curled up so that the docs and nurses have access to the back. Yep. How would a hospital go about becoming or utilizing? Oh, just drop us a note. Go to our website and just contact us. And you can contact me. I'm Jack at KindVr. And then we'll spin you through a presentation and see if there's a good fit with your hospital. Yep. Mad facts. Yeah. So yeah, you're right about somebody asked about the horizon line, and for supine, obviously the kids are laying down. So Simon created and his team created a really beautiful experience. Actually, the kids float up gently from the bottom of the ocean floor to the surface, and as they do it, they get to interact with the sea turtles and the whales, and the little seals come, and buoys show up and go away. It's early stages. We'll modify it, I think, based on what we're learning, but it's a wonderful experience. And VCUG is a very uncomfortable procedure, and there's a lot of interest in helping kids that way.
And I see two questions coming in. One asks about designing for pre-op anxiety, and another for how many experiences are available.
Yeah, pre-op anxiety is our study at Phoenix Children's, and it's all about helping the kids leave mom and dad in the pre-op room and go on a gurney on that journey into the OR. So Simon and I toured the OR at Phoenix Children's, and Simon built an experience where you can change the direction of the gurney. So sometimes the kids are going into the OR feet first, and sometimes they're going head first. So this experience doesn't have the occlusion that Simon talked about, but it feels very comfortable, and it was very successful in the test about lowering anxiety. Maybe as effective as some of the drugs that kids use right now. I know that child life specialists are keen to lower sedation rates, and we're pretty excited about that. So that experience is coming out on our in the fall. And I think someone asked how many different experiences. I think we're at 8 now. So Simon is releasing 3 more in the fall that will add on to our current. We have experiences for MRI practice, getting kids ready for an MRI, and it's a very successful procedure or practice for child life specialists to use. And of course, it's in test at Children's Colorado. So motion sickness with VR, so far in our 15 studies, no. There hasn't been anything, and that's partly because the VR equipment that we're using is very powerful. It's the latest stuff, so the world has to update perfectly with you. When the kids are moving their heads, the world has to perfectly update. So you have to have a powerful chip in there. And of course, the latest gear does. And then in our research studies, we are, not seeing it. And the other thing is Simon creates experiences that are incredibly gentle, right? So we're not exciting the kids. We're not any kind of Star Wars or dinosaurs. It's all about calming the kids down and taking them, as he said, slowly into the experience. So I think it's a combination of good equipment, but also the way that his applications have been built. Yeah. Are they available on various platforms? Oh, it's only on KindVr. So we do, a huge amount of work on the equipment. It's all modified so that you turn it on and the kids are instantly in the application where they would select maybe the Aqua or Animal Valley. And also the whole system is shut off, so it doesn't connect to the Wi-Fi or network. So there's a lot of things that are, kind of custom built. And the other thing I don't think Simon talked about is the infection control system. We provide these infection control kits to the hospitals that are single patient use. And that's an important part of the whole thing, especially with COVID, but it was always important. So the kids get a new face pad every time, and there's special wipes that are included so that they can disinfect the system right after it, and then clean the lenses with a lens wipe. So it is all of a package. Yep. And are there studies of burn dressings? Yet they're not with our system yet, but one of the hospitals that's joined is going to use it with burns. So we'll learn that way. Early days before VR was even started 7 or 8 years ago in a big way. There was a burn study done by Dr. Hoffman, and it was very effective in terms of lowering the pain. But it's an area that we haven't got a study started yet. We're going to push them out. Someone's asking about adding them. We contact our lead person at each of the hospitals, and we will push them out to the kits. So we are in Canada and the United States, and we're learning about international. There are a lot of different rules and regulations by country, and we're being very cautious, frankly. And we're in those early days of still. We have a lot of good work to do in the U.S. and Canada, but we are interested in doing it, in helping kids everywhere if we can.